There we go. It's the good doctor. You hear your doorbell?
Go ahead, listen. Of course, y'all didn't catch that. It's a house call with Dr. Tanya
House
George.
call.
It's house call with Dr. Tanya George.
Dr. Tanya George.
And tonight, the good doctor is going to be talking about breast cancer awareness.
Oh, God.
So I need you all to listen up, pay close attention, and give the doctor your undivided attention.
Really?
And let the spirit
Uh-uh.
move you in a way that it has never moved before. Amen.
Amen.
Amen. I'm going to have to get me another peanut gallery. I see right now. But I'm going to bring the good doctor on, and as I bring the good doctor on to talk about breast cancer awareness, I'm going to be in search of my peanut gallery.
Oh, my God.
Dr. George, how beest thou, woman of God?
Oh, my goodness.
Can you hear me?
Yes.
Yes, the people of God can hear you very well, ma'am.
Loud and clear.
Okay. All right. How are y'all?
We're doing well. How are you, beautiful? Look at you.
I like check the hair
I
out.
know.
Check the hair out.
We doing something different?
Yeah, trying to be fly and all this kind of stuff. What's happening?
She just like
We gonna have to talk off air after this. Here, we gotta call and find. We need to call and find out what's really happening. So after we get off air, then we can stop being prim and proper. Then we gonna get all in the business. I got. Yeah, I'm finna say I got my mama.
Oh my goodness. He is holding up his phone.
I saw my mama and my daddy this weekend.
What? You was over there?
Yeah.
Man, we up the street.
I called you.
She don't answer her phone. That's not the don't call. Don't do
but
that.
She didn't answer.
Don't do that, Tanya. No. Don't. If you ever need anything, do not call her. You be better calling.
Ooh.
If you don't have, you be better calling me. Don't call her.
That's so embarrassing.
It's not embarrassing. I called you. How's all right? I called you and you didn't answer. You just sat here and said, you didn't call me. And she just said, I did call you. You didn't answer.
Oh, my God.
I'm like, don't call her.
That was this weekend?
I don't even know why she got a phone. I don't know why she got a phone other than for her to sit there and scroll on Facebook.
Oh, my God.
And to take selfies.
Oh, my God. Which I don't post.
She don't post, but that boy, her phone is full of selfies, though. It's full of them. She done ran out of room. Camera about to break.
Oh, my God.
So, don't call it. You do better doing a hood signal. I'm going to tell you right now.
Oh, my goodness.
You do better doing sending the hood signal.
Yeah, Daddy had me on quarantine, though. He only let me as far as the garage.
Get out. He kept you in the garage. That sounds like it's something his son. He listening to Albert over here talking about putting people in the garage.
That's where I had LaVon stay.
He's a lie.
She was on quarantine. She had to be. I had to spray her down.
He's a lie.
Every time she came in, I had to.
No.
I had to do scrubs. You know, we had a washroom. Yeah, we had the washroom.
No.
So I had.
He gonna let me come in from the garage through the washroom into the kitchen, right?
No, I had a washroom. What's the sanitizing room? Yeah.
The washroom is the sanit. He's the lie.
I'm telling you. Okay. Anyway, I'm not finna play with you anymore. So, Dr. Tanya George, Dr. Tanya, what are you talking about this evening? What you got for us on breast cancer?
Yes.
Okay, so I chose breast cancer. My baby brother, well, one of my baby brothers, his wife's sister. So my sister-in-law, who's like, my sister, her baby sister, she's in her early 30s, and she just found out she has breast cancer.
Wow.
Dude, what?
At early 30s.
I think she has to be about 32, maybe 33. So, she's just now sending her daughter off to college and starting chemo.
Wow.
Oh, wow.
Surgery is being discussed. I'm not sure what options they're going to do with regards to surgery, but yeah. So she's been added to my prayer list.
Yeah.
Of individuals that I pray for every day. So she's been one of the ones that I've been praying for.
Okay.
So cancer
Wow.
has affected my family in so many ways
Yes.
and so many different types of cancer. Never anyone with breast cancer, but my mom had stage 4 colon cancer. My dad, prostate cancer. They both are in remission and survivors.
Amen.
My oldest brother, unfortunately, he was around 33. He succumbed to kidney cancer. Uncle passed of leukemia, my dad's brother.
Yeah.
My mom's sister died of jejunal cancer. I mean, so very, very close.
Right.
Cousins with breast cancer.
Wow.
Grandmothers with, I think, uterine cancer.
Wow.
Oh, Jesus.
I mean, I think my family could be like a case study itself.
Yeah,
Because
yeah.
of all the different types of cancers that
Yes.
we've had to go through. So when I heard of this, I was like, I'm going to talk about breast cancer.
Okay.
So one thing people may not know is that breast cancer, it not only affects women, but it affects men also.
Yes.
So in the United States, about 250,000 women are diagnosed with breast cancer each year, and about 2,300 men are diagnosed with breast cancer. So out of those cases, about 42,000 women die from breast cancer each year. And of the 2,300 men that gets diagnosed, about 510 die. So it's not exclusive to women, but it does happen in men also, but it's, way less common. Now, when you look at the different rates of cancer by races, overall, the cancer rates have stayed around the same over the years, but over the past several years, Black and also Asian and Pacific Islander women are having an increased rate. So for Blacks, it's 121.3 per 100,000.
Wow.
For Asian and Pacific Islanders, the rates are now 97.7 per 100,000, compared to their counterparts, white women, and it's just a huge difference. So they are increasing. They have not caught up to white women yet, but it is increasing. So it's something to keep in mind. We'll go through just the basics of anatomy. So, and I know the guys may not, but it's important to go through the basic anatomy in order to describe the different types of cancer. So you
Well, I guess
obviously
I might
have
as well
your
cut my mic
the
off
nipple.
then.
What did you say?
I said I might as well cut my mic off then because I done got kicked off now. It's about the women now.
Oh Lord.
No, it's not only about the women. Remember, men also. And you guys have similar anatomy. You just don't have all the ducts and extra connective tissue like
That's
that.
all right.
He
Yeah,
like,
go ahead.
he like
go
I
ahead.
don't want to hear
La la
that.
la 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 la. La 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 la.
So let's hurry up and go and skip past, and go through this real quick.
No, go ahead.
So
Do what you
have,
do.
like, a heart attack.
I'll go play
So for the
tiddlywinks or
breast-
something.
The breast, we got the nipple. We got the dark area. That's the areola. And then inside the breast, you have your lobules. Those are glands. That's what produces the milk for your babies. And then you have your connective tissue, is the fatty tissue, fibrous tissue, and you also have your ducts. Okay, and the ducts is what carries the milk from the lobules to the nipple so that it can be released. The milk can be released to the baby. Okay, so you have two different types of major cancer. That's the most common types of cancer. You have invasive ductal carcinoma. That's when you have cancerous cells that grow outside of the ducts into other parts of the breast tissue. Okay, and you also have invasive lobular cancer. That's when the cells grow from the lobules to other parts of the breast tissue. It's considered invasive because you can also get metastases, meaning that it can go from that local area, like the lobules or the ducts, then it spreads past that into the breast tissue, and then it can even spread even further into the body, into other parts of your body, other organs, other tissue. So, and we'll go through staging later on.
Okay.
But those are the two most common types of breast cancer. You also have a type of breast cancer that's less common, that's rare, called Paget's disease. Paget's disease affects the skin of the breast, like the nipple, the areola. You can get also lumps or tumors in your breast related to that. And when that happens and occurs, that's also considered invasive breast cancer. Anytime you have that kind of spread, it's considered to be invasive. And you have other even less common types like medullary, mucinous, and inflammatory breast cancers or disease that can lead to breast cancer. So some of the different symptoms of breast cancer, you can start to see changes in your breast. It can turn red. You can start seeing dimpling in your breast, kind of like
An indentation.
like an orange. You know how sometimes the oranges dimple in?
Yeah.
You can start to see changes like that instead of having like smooth surface of the skin.
Right.
Your nipple can actually also start to invert. So
Ooh.
instead of it pointing out,
Yeah.
it can actually start going inward.
Wow.
You can also have discharge from your nipple. Bloody discharge is a common type of discharge when you have breast cancer.
Jesus.
You can also have like irritation of the skin, also pain, and the change in the size of your skin of your breast as well. So if you start noticing that one breast just out of the blue starts to get larger than the other, and you have, some of these symptoms that I'm mentioning, then that is something for you to be of concern for and to be checked out. So there are certain types of risk that can make people more susceptible to developing breast cancer. Some of these risks are not changeable, things that we cannot change, and some are changeable risk. So some of the unchangeable risks, one is age. As women age, why you run away, Albert?
I told you.
No, because I had something. I had to go do something. I had to go. I had to
The
go get.
whole time she's talking about the nipple.
Well, because I had to go get my. I had to go get my. No, I had to go get my paper and my crayon because I was drawing a picture of it all at the same
Oh
time.
no, he was not.
Sure. Anyways, all right. So the unchangeable risk. So as women get older, our risk for developing breast cancer increases. Okay, so that's one thing. I'm not sure, you may have heard of like BRCA. People mention BRCA.
I've never
the
heard of
BRCA
that.
gene. So BRCA is like breast cancer gene. So there's BRCA1, BRCA2. Most women have heard this because we have to get exams every year. Our doctors usually ask us. So basically, these particular genes are considered tumor suppressor genes. But sometimes they don't work right, and they're not offering that protective nature against suppressing cancerous cells.
Okay.
So again, cancerous cells is just when you have just cancer, like your cells are just going crazy and they just start growing and, duplicating and multiplying just out of control.
Yeah.
So individuals that have that gene, obviously they're at greater risk. If you have a family member, like if your sister or your mom has that gene, that genetic mutation, then you're at a greater risk as well. Some other risk factors is if you've had an early menstruation or a period, as people call it, if you started before age 12. Also, if you have a late menopause after 55 years of age. Those put you at risk as well for developing breast cancer. If you've had breast cancer in the past, you have an increased risk of developing breast cancer again, believe it or not.
Really?
So just having a history of it can make you be at risk for developing it yet again.
Wow.
Wow, I didn't know that.
Obviously, yeah, obviously, any kind of breast cancer history, moms, aunts, and most of the time on your mother's side, maternal side, will give you a higher risk of developing it. Women and daughters who there was a medication back in like the 1940s to 1970s called DES, and it was used to help prevent miscarriage. But that particular medication that was taken in that population of women, they had a higher rate of breast cancer than other women.
Wow.
Ooh.
What else? People with dense breasts. Sometimes women have very dense breasts, and that can actually increase your risk of breast cancer. Also, what else?
Can
I
you?
think I went through most of them.
Can you-
So now
oh.
you have your changeable risk, things that you can change, things that you can work on to decrease. And you guys know I consider myself to be a Christian wellness advocate. I'm always trying to encourage people to live a healthier lifestyle. I need to take my advice too, because lately it's been extra stressful with a lot of things going on. But some of the things that we have to really be cognizant of is our level of activity, because physical inactivity can actually increase your risk of breast cancer. So obesity, low activity throughout the day, throughout the week, that can increase your risk. Also, if women are menopausal and they start hormone replacement therapy, that can put you at risk as well.
Really?
So that's something that should be, discussed with your provider, whether or not the benefits outweigh the risk.
Wow. Okay.
Also, if you have never had a child, that's considered to be nulliparous. That puts you at risk. Also, if you've had your first pregnancy late, which is after 30. And I was like, why had to be after 30 though? But anyways, if you've had your first pregnancy late after 30, 30 is, after 30 is considered to be late to be childbearing.
Yes.
I'm like, whatever.
Why?
Anyways, I don't know.
Considered
I'm
high
not trying
risk.
to hear that part right.
Yeah.
So
Yeah.
anyway,
Oh.
Yeah.
Oh.
Because I was
excuse
high
us, doctor.
risk. Yeah. I was high
I'm
risk.
not trying to hear that part, but
Yeah.
this is the science. But me personally, I'm not trying to hear that after 30 is old for kids. Anyways,
Oh,
so
okay, moving right along.
moving right along. So other things that can be changed that
Yeah.
are risk is alcohol use.
Yes.
For those that be sipping on the alcohol, oh, I just drink wine. Oh, I just drink a little pint of whiskey or whatever it is people drink,
Yeah.
of developing breast cancer.
Okay.
So
High risk. Okay.
Okay.
those people, yeah, that's something to really think about. So how can we reduce and lessen our chances of that? So healthy weight, maintain your weight. Make sure that your weight is matching your height.
Well,
Oh Lord,
I know.
I'm short. I'm 5. I always say I'm 5'2" and 3/4.
I
because
know.
what
That
does the fraction go do? What's the
Those-
fraction? What's the fraction
Hey,
for?
give it to us.
those
What's the fraction for?
3/4 matter.
Yes, they
Those
do.
3/4 is closer to that 5'3"
Yes.
than it is to the 5'2".
Ha!
So on my driver's license, it says 5'3" because they rounded up. So anyway,
We'll say
have
5'3".
to-
Go 5 and 3/4, 5 and a half, 5 and 1/3.
5,
What?
2 3/4. Yes, sir. So anyways,
Okay.
always,
let you have it.
it's not just like your weight. So someone can get on a scale and they can be 180 pounds, but if they're like 6 feet tall or whatever, they're lean, they're stretched out. For somebody like me that's that height, I'm supposed to be no more, according to BMI chart, I'm supposed to be around 138, 139 at most, and that's the high of my normal weight.
Oh, dang, you
I
frail.
know some people don't believe in BMI charts and think it's for other
Yeah.
races and things like
Right.
that.
Yes.
138, 140, you frail.
That's exactly.
Baby,
I'm
we need to
like,
feed you.
they need a chart for us. You
We
know.
need to feed you.
But the
Put some meat on them bones.
reality is having done bariatrics also for years, bariatric weight loss surgery, and hearing that statement commonly, that's not for us, it's for other people and stuff like
Yeah.
that. And if I just would throw out some numbers and tell us people that are
brown people?
minorities, that are
Yeah.
black people, brown people, that we have the highest rate of, this diabetes. We have a higher rate
Obesity,
of
yes.
obesity. We have
All
a
right,
higher
come on
rate
now,
of
here we
that.
go.
And then we have a higher rate of death because
Uh-oh.
of this and that. So I'm one of those people that don't like to hear, oh, it's not for our race, because the numbers are not lying about how our comorbidities are affecting us.
Yes.
The numbers are not lying. And obesity is a comorbidity. It's an illness. So that's a separate whole other tangent. But anyways, physical inactivity. So we should maintain a good weight. Am I 138? Nope. I'm 20 pounds over. I don't care about telling my weight. I am 158.
Okay.
I've been working on getting down and, getting smaller, but it is a struggle. And the older you get, the harder it is as well.
Yes.
But it's something that I am cognizant about, and I'm working on that myself.
Yes.
Remember, people, for me, is all about overcoming. It's not about speaking to you as somebody that overcame, because we're all growing and we're all working on various aspects of our lives.
Amen.
So I never come preaching like if I'm perfect or anything like that.
Yes.
It's all about overcoming, not that I overcame.
Okay.
Some of the other things that will help reduce your risk of breast cancer is if you have a baby, to breastfeed. Breastfeeding can actually be very helpful for not just the baby getting nutritious milk from the mom, but also for the women. It reduces our risk. And this month is actually Breastfeeding Awareness Month,
Okay.
which I did not know until I was looking up some of the statistics. So August is Breastfeeding Awareness Month. So those women that have little babies, I encourage you, or that are about to have babies, I encourage you to breastfeed. It does babies wonders. It's very good for the baby. Again, abstaining from alcohol is another thing that we can do. So what are some of the ways that we can diagnose or screen for breast cancer? So one of the things that we can do is self-breast examinations. You might want to close your ears again, Albert. But
No, I want to listen
every
this time.
month, every month we should do a breast self-examination. We are with ourselves all the time, right? So how often are we going to see our OBGYNs? They see us maybe twice a year, maybe. It depends on, what your clinical history is.
Yes.
But most of the times, twice a year or once a year that you're seeing your OBGYNs if you have normal visits.
Yes.
So every month, usually about 3 to 5 days after your cycle has started, then that is the time period that you should go ahead and do your exam. And there's 3 different types of exam that you can do. There's an exam that you can do in a circular motion. So you start from either outside or start inward where your nipple is, and you work your way around and you go in a circular motion until you cover all areas of your breast. Exam where you just think of your breast in wedges and you go from outer inward, palpating to make sure you are not feeling any new masses. What's good, y'all?
Okay, you there? You still there, Dr. George?
I can see you guys. I
You
just
can't hear?
paused. Y'all can't hear me?
Yeah, we can. I can hear you. Can you hear us?
Oh, I can hear y'all.
Okay.
I just saw all the movement. So I was like, I didn't know if y'all was hearing me. I was like, what's going on?
No, you keep going.
Oh, okay. I was like, I didn't know what was going on. So I
Yeah,
stopped. I
yeah.
apologize. So screening. So we were talking about the self breast examination. So there's the wedge method. There's also the vertical method that you can use. Basically, you're just trying to check your breasts every month around 5 days after your cycle has started to make sure you don't feel any new lumps. Make sure everything is feeling the same. You don't want to do it while you're slumped over sitting in a chair.
Okay.
The best way to do it is if you are sitting in a chair and your arm is up
Yes.
over your head so that you're stretching out.
Oh my God.
Perfect. See, there you go.
Is he trying
You're
to show?
stretching out that
People need
arm,
to see this.
or you can do it lying down on the bed with your arm up, just like that. So, are you going to demonstrate it?
He's demonstrating.
Okay, perfect.
I'm
So
demonstrating
you
for
can
the
do
people.
Either one of those methods, the circular wedge
Yeah,
or
the circle-
vertical,
the
and
circle-
just
Nah, I ain't finna do the
healthy-
circular wedge. Nope. I ain't doing that one. Nope. Y'all, I put my arm up. No, we ain't doing no circular wedge.
You supposed to be
Nah.
demonstrating so your arms
I
up
did.
and you circulate.
I
You supposed to-
demonstrated.
No, you did.
I did.
You just put your arm
I
up,
demonstrate.
sir.
I did. She said one of two. One or the other.
Oh my God.
I did the one, not the other.
All right. So do those. Also, clinical breast examinations when you go see your OBGYN or your family provider, your primary care provider, they too should also be doing an exam. If your OBGYN is not, that should be done, during your visits so that they can see if they feel anything present. Now, one thing to note is that sometimes we do have lumps in our breast that may not be anything. Don't say, oh, it's not anything or whatever unless you get it checked out, because sometimes we can have just cysts. Some people have very fibrous, dense breasts and they have a lot of cysts. Some people have to get cysts aspirated, cysts removed, because sometimes they can get inflamed. Sometimes you just do nothing with them. Most of the time you do nothing. And sometimes the size of them will increase or decrease.
Okay.
But if there are changes in a lump that you already know that you do have, that is something to raise awareness to your provider, to let them know, well, the mass that we knew about, that we checked before, it's growing. So that you can then have further testing or further examination to see if, it's anything significant, okay?
Okay.
So the breast cancer is staged in various methods. They have it's multiple, it's complex, and I'm just going to briefly just mention the different types of ways to stage. They have a TNM, staging tumor node metastasis. So based on how many tumors or how many lumps you may have, whether you have nodal involvement, your lymph nodes, because sometimes, like if you have breast cancer up in your axillary region, you can actually have lymph nodes that get the cancer as well. It will spread, and that spread is called the metastasis.
Okay.
So they have this whole staging system for that. They have a grading system. They also have biomarker testings, etc. We really don't need to get into that because it's really complex. And if you're not a clinical provider, it can kind of be overwhelming to try to, go through it and have you guys all understand it. Not saying that y'all can't, but I think just for this discussion is just to know that there's various ways that the staging can be done.
Yeah.
So if you hear people, the TNM is very common. If you hear some people say T1, N0, M0, that means that they had one lump, no nodal involvement, and it didn't metastasize.
Okay.
So when you start seeing those numbers go up, you got a T2 and T3, that means that they had multiple masses, multiple lumps. If you see on the end they had one or whatever, you see that they had some lymph node involvement, because when you do go ahead and do surgery for this, and say they were doing a radical mastectomy, or removing all of the breast tissue, and they also do an lymph node dissection and taking out the lymph nodes, and they find through the pathology reports or through the pathologist looking at it under microscope and things like that, there's multiple lymph nodes that were involved, then that means the cancer was that more aggressive, and that the staging was higher. Okay, so you can actually get breast cancer, and it can spread to other parts of your body. If it's left undetected, it can go anywhere, to any type of organ. I have someone that I know that their mom had breast cancer, and that breast cancer then spread down to her biliary system.
What is that?
And she won the
biliary system. What you just said. What is that?
Yeah, that's like by your gallbladder, your bowel ducts.
Okay, that's what I thought. But I just want you to break it down for everybody else.
So, and it just spread there. So, person wind up having to have multiple surgeries, repeated surgeries. And remember, like I said earlier, if you've had breast cancer before and they took the lump out, or they did a mastectomy, you're at greater risk of developing breast cancer again, unfortunately.
Wow.
Wow.
So some of the different types of screening, in addition to clinical breast exams and self breast exams, they have various types of tests. You can have an ultrasound done, and that's just looking to see if, say, that the soft tissue, sometimes you can get an abscess inside your breast or anywhere. It's just to kind of give you a better idea of what type of mass you're dealing with. If it's like a mass with fluid in it, if it's a solid mass, etc.
So you can get abscess in your breast?
Yes.
Huh?
That's what you missed that.
No, I
Say
said
that again?
I said that I didn't know you could get abscess in your breast.
You missed that.
You can
I
get an
didn't miss
abscess
it.
anywhere.
I just said I didn't know that.
Yeah, you can get an abscess anywhere. Anywhere in your body, you can get an abscess. So other types of screening methods, like diagnostic or screening methods, you can also have an ultrasound guided biopsy. So say you do have a mass, they can actually use, radiographic machines to locate the mass, to then go in with a needle to be able to take just a piece of that tissue out, so that they can send it out for pathology to see if it's cancerous, or to see what the nature of the cells are. You can have a mammogram, or as some of the individuals in my family, or older individuals, I hear them say, mammiogram.
Yeah.
And I'm like, it is not a mammiogram, it's a mammogram.
What works is whatever works. Whatever works.
Oh no, that hurts my ears to hear that,
Oh.
mammiogram.
Oh my goodness.
And I'm not gonna say who says that in my family, but someone in my family says that.
Oh, you gonna put him out there
I
though.
know.
I'm not gonna do it.
You put him out there. Oh, that's funny. You gonna put him out there, but you ain't gonna put him out there. But you gonna put him out there now though.
Look, I have discernment.
Okay.
She has discernment
Okay.
now. Oh,
I'm
she
not-
has
I'm
discernment
not
now.
gonna do that to them.
Yeah.
Okay.
So I can about know who that is though. When you use, he said you got discernment. Yeah, I can just about guess now. Sure can.
Oh my God.
All right. So a mammogram. Also, you can get an MRI done of the breast as well. Those are the major ones: ultrasound, mammogram, MRI, and biopsy. So usually women, as we start getting older, not like me, because I'm still like in my
Look at her.
Anyways,
Did she just plug herself? Did she just plug herself right
Yes.
just then?
And speaking of plug, Dr. George, can you give us your book? You're going forward with that or no?
I was finna say,
it's all about breast cancer, though.
I know, but we're coming down to the end of the time.
I know.
So I wanted you to get your little plug in.
I know. But I'm almost done.
Okay.
I'm almost done. So, main thing, people, reduce your risk, get checked. There are various types of, age groups for getting the mammograms and stuff. You have to talk to your provider because every different organization have different suggestions. Some will say annual after age 40. Some will say annual after age 50. It varies. So, anybody had any questions? Because I can't see any comments or anything. I don't know if anybody had any questions.
Yeah, I put it out there to
If-
ask.
if anyone has any questions for Dr. George, if anyone got any questions for Dr. George and about breast cancer and what you need to do, how you need to do it, the way you need to do it, and if you want to get technical or non-technical, put your message on put your question on Facebook, or you can give us a call 214-431-5032. Again, that number is 214-431-5032, or send your question via Facebook. Either one. If you got any questions for the doctor as it pertains to breast cancer and breast cancer awareness, hit us up, because this is a huge. I don't know. I guess since both of y'all are women, obviously, I guess the question I would like to ask is this a difficult subject to talk about amongst women, or is it okay for women to talk about amongst themselves, but it's a hard topic to discuss with other family members? I guess if you have it, or if you like you said, when you come to the lumps, even though it may not be cancerous, but I know a lot of women, when they feel lumps, that it's like a
red flag, so to speak.
yeah, like a red flag. Everyone is like, dun dun dun.
Hey, Taisha, she just joined.
I think so.
yeah.
I've had that experience. I don't know, maybe about 11 years ago. I had a mass. Had to get a mammogram. They were like, "Oh, we think it's something." Went through all these testing, and it was nothing. It was nothing. So, it does scare you, though.
It does. I mean,
Yeah, and it just depends on the type of person. The way I am, I don't care about talking about anything with people. Y'all know me. I just let it out there. So it just depends on the person, how they feel about it and how their family dynamics are. But it is difficult when you do find a mass and you're wondering, because I've experienced that myself. And with my family history of having various types of cancer,
Yeah, my stepmother passed from having complications from breast cancer. She developed a lump on her side. She hid it from us for a long time, and then by the time that she did tell my sister, it had really gotten hot, and it looked real red, you know. So she had the am I saying it right?
Mammogram.
A mammogram.
It's difficult for you people that got lists.
But the surgery, the surgery.
Oh, the mastectomy?
Mastectomy, she had that. And then the complications of the chemo caused her to have strokes, which left her very childlike, before her passing. So she did succumb to it, but it was something in the women in her side of the family. So my sister is very careful to take care of herself, to be watchful.
Just get checked, women. Check your breasts every month and get checked. Okay? And look.
There it is. Yay!
This is the first copy, but I sent it back to the illustrator because I found a couple of things I wanted to change. So it's
There you go.
in process again. And
So-
guess what else?
Yeah.
My
What else?
website is up.
Oh, your website, give it.
I put it up last night, so anybody interested in going on, It is www.nooniland.com. That's NOONIELAND.com. And let me know what you think.
All right.
All right. Well, y'all, we get down to the end.
Yes.
And again, Dr. George, it's always a pleasure
Yes.
for you to become on here, even though she is like a sister as well. But it's good to have a doctor in the family.
Yeah, it is. She's fam, y'all.
It's always good to have a doctor in the family, and
Yes.
for her to come on here and to give her expertise in the areas that affect each and every one of us. And if there is something that you would like for Dr. George to speak about or talk about,
Yes.
let us know.
Put them in the comments.
Put them in the comments. Send us a message. Call us. 214-431-5032, but only call us on Wednesdays from 7 to 9. That's when we are on. But yeah, if there's some subject that you would like the doctor to talk about, or that's near and dear to you, and you need medical advice or expertise, let us know, and we'll give it to her so that she can look at it in time and get it all, get your questions answered, and
We'll go from there.
go from there, and maybe alleviate, dispel some of those old wives' tales
Yes.
about certain things. So hit us up. But if you would like to partner with Walk the Talk Ministries,
Yes.
or if you need, first of all, if you need prayer, please,
Yes.
if you need prayer,
If you need prayer.
reach out to us through our Facebook page, Walk the Talk Ministries, and personal message us. If you don't want everybody to know what you need prayer for,
Yes.
please personal message us so that we can join with you in prayer. If you would like to partner with us in making any type of monetary donations, we have 3 ways which you can do that, which is PayPal, which is Walk the Talk Ministry, Cash App, which is $ Walk the Talk 18. Or we also got Venmo. Yeah, we got Venmo too. And the Venmo is Walk the Talk Ministries 18@gmail.com, or it is my name, Albert-Wilhite. So either of those 3 ways, if you would like to make a monetary donation and partner with us, and trust me, our funds are going toward the ministry, and trust me, our funds are being used to help and minister to people, and we do keep track of what we spend and how it is spent.
But we want to thank those that have sown into us.
Yes.
We want to thank those who have sold their tithes and their offerings. We appreciate it. Everything.
So very much.
Yes, everything. We appreciate it all.
It's not for us, it is for the kingdom.
Yes.
And trust me, every dollar, it is spent for the kingdom.
Yes.
And for the edification of God's people. That's what this is all about, and this is what it's for.
Yes.
So without further ado, y'all, we thank Dr. George for
Bye,
coming
Dr.
on.
George.
Bye, Dr. George. Y'all hit my girl up, nooniland.com.
Yes.
And the book, what's the name of the book again?
It is Beyond the Clouds.
Beyond the Clouds. The book is called Beyond the Clouds, y'all.
Yes.
Check it out. It's our first publication. It's for children's. It's for your children's.
It won't be available for purchase
Until-
for another couple of weeks, but if you go on my website, you can pre-order.
You can pre-order. Okay.
Awesome.
Y'all heard that. So, y'all, we finna get up out of here. We got to go. We got to get up out of here. We got to go. We got to get
All
up out of here.
right.
But,
And Taisha. Hey, Taisha.
hi, Taisha. Yes, Taisha. Hi, Taisha. The whole Vassar family. Our sis.
Yes.
In the spite of her, in the spite of them losing everything in the fire, our sis joined us on our podcast.
Yes.
So her faith is strong.
Yes.
The faith of the family is strong. We love y'all. We
love
appreciate
y'all.
y'all. And of course, we're there for y'all. And we love y'all very much. Tell our God, baby, we love her too.
Yeah, tell my God, baby, hey, I'm
Hey.
going to send her a new bracelet.
So, all right, y'all. We finna get up out of here. So, God say the same. We will see y'all again next week. Until then,
Please be safe, people. With Hurricane Laura, please be safe.
Yes.
yes, y'all be safe and stay prayed up. And remember, don't ask where are you, God. God's asking, where are you? God's asking, where are you? Until then, y'all, get to know Jesus. We'll talk to you. Bye. Bye, Dr. George.
Bye, Dr. George.
Until then, y'all, we'll see y'all. We out. Love y'all. Peace.